Yo.
What up, though?
I got to talk. I got to tell what I feel. I got to talk about my life as I see it.
All right, then. It's time for you to bring it to the table.
Turn up your radio wherever you at. We about to bring it.
Street Beat.
Yeah.
With Tony B.
For the next hour, Tony B will give you a chance to tackle local, national, and international issues that affect your community.
Street Beat. Street Beat.
With
Tony B.
Good, almost afternoon, morning, I guess, kind of in the middle of that. It's me, Tony B, and we have a special show for you today. Welcome to this week's edition of Street Beat. We're going to be talking about healthcare, more specifically, NeighborCare. We're going to find out a lot more about NeighborCare. We'll find out, I guess, everything you wanted to know about NeighborCare, but didn't even know that you should ask about. We're also going to talk about healthcare a little bit. Now, NeighborCare has a fair taking place between 1 and 4 this Saturday. We'll find out more about that. Yeah, we'll find out more about the healthcare that takes place this Saturday. But interestingly enough, there are some issues about care and how that works, and if people are losing their health care. And we're going to find out, hopefully, if we can get some kind of litmus test on what the care of our community in South Seattle is right now, and what the health of our community in our South Seattle area community is as well. Joining me on the program right now is the clinic administrator for NeighborCare, Juiles Smith. Juiles, how are you?
I'm doing good. Thank you for having me, Tony.
Well, it is so good for you to be here right now. I mean, it's awesome that you're having a health fair, but I'm thinking the timing for this is also excellent as well.
Yeah, National Healthcare Week.
Yeah, National Healthcare Week. That's another thing, and that's a great. And it's kind of in general, folks. I think right now are a little unsure about things that are taking place with the current federal administration.
Yeah.
So, welcome to the program.
Thank you. Thank you for having me.
All right, I want to start off, Jules, by talking a little bit about you. I'm getting your Kool-Aid a little bit.
Okay.
And tell us a little bit about your background, where you're from.
Yeah.
We'll start with that.
So born in Washington State, particularly Spokane, Washington, came over to Seattle.
Eastern Washington.
Yeah.
Okay.
Yeah, I came over to Seattle. I'm in grade school. Graduated from Franklin High.
Same here. Quaker. Go Quakers.
Okay. Yep. And then I started my journey with NeighborCare in about 2011 when they first opened the Rainier Beach clinic down the street. Started off as a receptionist.
Started off as
a receptionist.
As a receptionist.
And then I was in school for a medical assistant. I did that for a number of years, and then turned around, became medical assistant lead, a medical assistant supervisor, and then down here, Columbia City, I'm the current clinic administrator.
All right.
So I've had a long history with NeighborCare, lots of growth.
All right. What is it about healthcare for you that interests you, that keeps you passionate about this?
Yeah, I originally started off as a certified nursing assistant in 1996 was my first job. I took care of a lot of death and dying patients.
Oh, wow.
It's my background. I've been in healthcare for over 20 years. The passion is to give quality care, to make sure that patients are heard, that they have a voice in their care, and that if they don't have a voice, that we are the voice for them.
Awesome.
Yeah.
Awesome. So NeighborCare, folks may have heard about it. Obviously, there are a lot of folks in our community who take advantage of the services that you provide. Let's start with NeighborCare. Can you tell me a little bit about the history of NeighborCare, how it came to be?
Yeah, NeighborCare has been around for about 56 years.
56 years.
Yeah, serving over 60,000 patients in this community. Far south as Rainier Beach, of West Seattle, High Point, and then going up north, we have our Lake City, Meridian, and 45th Clinic, including a Magnuson. We are in most of the school-based clinics here in Seattle, Washington area. So we provide care for kids when they're at school, and then we have medical and dental servicing line, midwifery. UW residency, so have lots of connections within the community with other services as well.
Wow, there's so much to talk about. We're going to get back to some of that. Right now, I want to talk about the health fair.
Yeah.
A little bit before we get into some more stuff. We have a health fair coming up this Saturday from 1 o'clock to 4 o'clock. There's the information. You see it on your screen. A health fair. Let's talk about what the health fair is, what's going on, what folks can expect, what's going to be taking place on 37th and Genesee, right?
Yeah. Okay. So right down the street, we're hosting our first healthcare, hopefully an annual thing, in honor of National Healthcare Week. So providing services as far as screeners for vision, well-child checks, immunizations, fun, food, games, raffles. We've had some people donate some really awesome gifts to give away and give back to our community. And then also have vendors of the community that will be tabling to share in the event.
All right. And this is from who is welcome? Is everyone invited?
Everybody's welcome.
Everybody.
That's right.
Everybody. All ages.
Yeah, I hope to see you there. Yep. All ages.
Okay.
Yep.
Okay. So we're going to go back to that and talk more about the health fair from 1 o'clock to 4 o'clock, right?
Yep.
One of the things that I found interesting about NeighborCare that I did not know was that y'all provided the main kit in schools. How does that work? Tell me about that.
Yeah, so we have usually it's one provider and a nurse or a PSR that provide in care like services that have to do with kind of contraception, confidential visits and things like that. So we provide care to kids that are either not able to get to a clinic or behind an immunization, so they don't have to miss school. Parents don't have to pull them out of school to get the care done. It's been awesome. It's an awesome program.
Okay. Now, how does that work? Do you have to sign up for it? If you're in school, do you automatically become eligible for this care?
Right. The service is available to anyone that's in the Seattle School District. Yeah.
Well, that is good to know.
Yeah.
That is good. It's something that we don't think about. We know that we have a ton of kids in school. Yeah. Which is going to be starting up pretty soon. I know you don't want to hear that right now, but for the parents out there, when there is an incident that happens, and I'm kind of, so what takes place? Do you have to get a parent's permission? Do you just treat the student at that time if it's an emergency? How does it work?
Yeah, we do get permission from the parents, just depending on the patient's age. And then there is a right to treat at a certain age without parent permission. I believe it's in the state of Washington, it's 13 and above, where they don't need to have consent, is what it's called, to get treated. So giving everyone the right to care, not depending on their age. Yeah.
Well, this is something that I'm a little, and I know you may not be prepared for this, but we're doing it. We have been doing a fentanyl awareness campaign, and found out that K-5 schools have Narcan.
Yeah, a lot of like our last CPR class told us that we should carry it. They were giving us websites where us personally could put it in our bags or purses and have it on our person to support someone in the event of an overdose. Yeah. Now
that makes sense because of what it is and what it can do. So my question: have you witnessed? Have we been having issues with fentanyl in our K-5 schools? I would like to hope not. It's glad that they're there, and there's a solution there. Is this something that is just there for safety, or have we been having an issue?
I believe it's there for safety. I have not personally heard of any incidents that have happened in the K-5. But it's just also good to have. You never know. You never know what a kid has gotten into or what they have at home. It's always great to be prepared.
Yeah. All right. Again, you are listening to Street Beat. It's me, your host, Tony B. We're talking healthcare this morning. NeighborCare is here. Juiles Smith, clinic administrator for NeighborCare. Now, was it National Healthcare Week? Hopefully the goal with National Healthcare Week is for everyone to become more aware of their health, become more aware of their health providers. What do we want to get out of this week? What would you like to have happen during this week?
So our goal is to introduce our community to all of the resources that we have in this area. There's so many, from the gym to the banks to the nutritionists, And then bringing them back to healthcare, letting them know that screeners and things can be done, doing like minimal check-ins, getting them scheduled for appointments, whether that be medical or dental. We have King County as one of our huge vendors, providing WIC and dental screenings for patients, and just bring it all together for that whole care. And that's our goal with NeighborCare, is that, you know, we want to serve the patient in a whole, not just treating what they're coming in sick for, but addressing all issues when they come through our door.
So what is, and this is, again, this is a question you may be ready to answer, but I'm thinking the health of our community. Is this something that y'all monitor, that you become aware of? I know that there's a title, epidemiologist or something like that, where they check the, find out, am I getting this right? Am I close on, where they check to find out, well, what are the trends that are happening in the community? For you to be right here in Columbia City, is this something that you can talk about, or that you have awareness to, or that you keep aware? What's the health of our community? Do we know that?
Yeah, I mean, I would say it's a pretty tense time for healthcare right now. I feel like with the political climate, we're very protective of our patients and aware. As much as we know, we try to be very transparent and let our patients know, keeping them informed, letting them know that we are a safe place for them to come and receive care. And as far as I know, nothing is changing with how we provide for services for our patients. And that's the awesome thing for NeighborCare.
Now, you talked about the privacy. In the Black community specifically, there has been a history of, I'm just going to say, over 25% of African Americans die waiting for health care. And there's kind of a lack of trust in the healthcare system. This thing about privacy, why is that so important to patients?
It's just trying to build that relationship with the patient. So I have providers that have worked for NeighborCare for over 20 years. And they've cared for the mom, they care for the kids, they care for the grandkids, and just building that trusting relationship with the patients makes it for better care. They want to come back. They want to talk to the doctor. They feel comfortable sharing what illnesses they have. And maybe it's an illness about someone else in the family, and they get them to come in. So it's like almost like word of mouth. Like you find something good, a good gym, or good food, and you share that information with everybody else in the community so they can get that good food too. And that's how I think about it.
I'm guessing that one of the things about an entity like NeighborCare being community-based, the way that you are, it gives you an opportunity to develop more of a relationship and have an understanding of what some of the unanticipated challenges are that are taking place in that particular community.
Yeah, absolutely. A lot of our staff are from the community, so they identify and relate. We have staff members that speak almost all of the languages of our patients that come through our doors. And that's also breaks down a barrier, and it adds to trust when patients come in to see a familiar face, someone of their culture, to help them get through the door and get through the services that they need.
Again, over 60 years, community health centers have been there for people, no matter their income, right? Or insurance status.
No.
And I want to make sure we talk about that. So it doesn't matter if you are feeling like you need this care, you don't have insurance.
Right. Come on in.
Come on in.
Come on in.
Come on in.
Yeah, we provide care to everyone, no matter their social status, their cultural, or their financial, which is an awesome thing.
NeighborCare.
Yeah.
NeighborCare. If you're unfamiliar, they're here anyway.
That's right. Yeah. Yeah.
I like the fact, because I'm going to tell you, I pass by that building all the time.
Yep.
And I don't know how many times I've passed by there.
Yeah.
And I occasionally will see people coming and going, and I'm glad it's there. But to have that facility in our neighborhood, maybe you can share some stories about the impact that you've had in this community.
Yeah, I feel like because I am of this community, raised here in the South Seattle area, did basketball drill team down there in that field. Being a young teen and new to healthcare, or very independent in the late 90s, kids were just kind of left to do figure it out. And NeighborCare was a very open door. My story, in short, is that very unsure of healthcare, very non-trusting. And I built my relationship with NeighborCare before I became an employee. So that part of it, and being in the community, having familiar faces, warm, welcoming people, and then taking people as they are. We meet people where they are, whether they have the funds or have the knowledge. We provide them with that along the way.
Now, you think about UW or are there limitations? If someone says, "Oh, I'm feeling whatever," can they go to NeighborCare? Is it an emergency facility?
We're not emergent. We do have same-day walk-ins. We will advise. We can triage. The nurses will triage to make sure that the patients are fit for care.
Now, see, and it might be me, but somebody else out there. Triage.
Yeah,
that is
assess service. Assess what's going on with the patient to decide if they're fit, if we can provide the best care. Okay. And if not, we will send you on to the emergency or urgent care.
Okay. Yeah. See, I'm picking up the lingo.
Yeah, but still come in. It's good. We can still give you information about how to direct your care.
Now, of course, we're live right here on Rainier Avenue, so you hear what happens. Fire engine just went by, which happens. And again, we're live on Street Beat right here on Rainier Avenue Radio. My guest is Juiles Smith, who's the clinic administrator for NeighborCare. We're having a discussion during National Healthcare Week about all of NeighborCare, but we're hyper-focusing on the Columbia City NeighborCare, which is on 37th and Genesee.
37th and Oregon. Well, between Oregon and Genesee.
Okay, yeah. Between Oregon and Genesee. Between Oregon and Genesee. But right on 37th. Yep. And the health fair is taking place, and I'm going to be redundant about this. Yeah. This week from 1 to 4.
From 1 to 4. Yep. Food, fun, screeners, food trucks are coming down to feed people, lots of games for kiddos. So hopefully everybody can come down, and the weather's great, and enjoy. We're hoping to have a good turnout. We're doing well child checks for kids that need to go back to school, immunizations for children that need to get done before they go back to school, which is a huge thing at this time of year. And usually a long wait list for people to get in to get those immunizations, to get people. So we're hoping to help and serve the community and do our part.
All right. Yeah. Again, 1 to 4. I think it's 3700. Is that the address?
4400 37th Avenue.
Oh, okay. One more again. You say it.
4400 37th Avenue South.
37th Avenue South. 4400 37th Avenue South. Everybody can come. It's from 1 to 4. Yep. Games available. Yeah. Fun available. Raffles available. Yeah. This is the first one, right?
This is our first one. I hope it's the first of many. Okay. We're hoping that it's something that we can continue on for years.
And so what was the impetus this year for saying, you know what, I think we need to do a health fair? We have back to school fairs. We have all kind of different events that take place during this time of year. What was the reasoning for saying, you know what, let's have our first health fair?
Yeah, I think the original idea of us is that connecting with our community and the partners within our community that service patients as well, and us all coming together at one event to provide services, let people know who's out here. We have lots of buildings in between. Columbia City's kind of like got hidden gems everywhere. So hopefully that they table. They've been invited, and if you don't make it this year, look out for an invite for the following year. But hoping to just connect patients with the resources that they have in this community.
Let's talk about the multitude of services that you offer at the clinic. I can read them off or whatever, but tell me about some of the services that you offer.
Yeah, so at Columbia City, we have medical providers with family practice. We have midwifery, who service patients who are going through their pregnancy and thereafter. We have a pediatric department for UW residency program who just see only children and get them well child checks and back to check and provide care. Yeah, but the NeighborCare, we also have dental. And
so there's also dental.
There's also dental within NeighborCare. Yeah, our Columbia City clinic does not have dental, but our sister clinic, Rainier Beach, does.
Okay.
High Point, a lot of our larger clinics have dental clinics within our medical clinics as well.
Okay.
We have pharmacy, so you need medication on the way out the door. We provide that service.
It's pharmacy as well.
That's right.
Oh boy.
We try to be, like I said, that one-stop shop, that whole clinic for patients, so that when they come in, they get their care and they get everything they need while they're there. Sometimes it's hard to get people to come back, and working on that, providing the resources to other people. Like we also house our building with King County Public Health, which also has their WIC office, their nurse outreach, and they have dental upstairs in our building. So we share our building with King County and share resources, which is awesome for our patients. Yeah.
Having a facility like NeighborCare, the origins of community health care. Can you talk about that a little bit? Are you familiar with, now again, we're talking about NeighborCare. How many of them are there here in
16? Is there 16?
40 something?
16. Don't quote me on that number.
Okay.
It was one of the numbers in my notes and I don't recall, but I want to say 16 if you're counting our school-based clinics. Something like
wow.
that. Yep.
The role, because some folks may go, well, what is the difference between NeighborCare and maybe urgent care and Swedish or the University of Washington?
I think NeighborCare strives to provide care that meets the needs of the patient. So we adjust, we accommodate. Sometimes we bend our rules. Our providers stay late. Our medical assistants may work a little later just to make sure that our patients get the things that they need. So we're flexible with the community and the climate. I think we're ever changing, just like any other organization, but identifying with the patients that we serve so that we can build those trusting relationships and they continue to come back for care, which provides for great health and longevity.
All right.
Yeah.
So I mentioned to you that I wanted to just talk about healthcare for a minute. Again, without getting into great detail, folks are concerned about losing their healthcare. How does this impact NeighborCare and what you do? Is there funding that you receive federally that might be cut? We'll start with that. Are you concerned at all about having to cut back on services?
Yeah, I mean, that has been a concern since this political climate. NeighborCare, no, we have not. We are not concerned at this time about losing funding. We also, we plan to continue to give care and provide care to our patients in any way possible. We have people working behind the scenes on grants and funding and all that to try to maintain. So, and I'm sure a lot of organizations are worried and trying to figure out how and what will happen. That unknown is, we don't have the answer to that now, but we'll continue to do the care that we are here to do until we cannot.
And have you noticed a change in those who you serve in the community, in their awareness, or maybe unsure of can I still come in? What am I going to be responsible? I don't want to get myself in so much debt,
right?
Which is always a concern when you're talking about healthcare. Have you noticed a change in the community?
Yeah. I can't speak for every organization, but for us, we have those conversations on a daily with staff that come in. They come in with letters, with changes to their medical, their insurance. So we have eligibility. We also have social workers and behavioral health on our team to kind of provide them with that support that they need, answering those questions, reading their documents, giving them clear explanations on the things that are getting mailed out to them. A lot of them is English second language. So it's kind of hard for them to interpret the forms that they're receiving. So we also help them work through that.
It seems like it was forever ago, but while it was going on, it felt like it was going to last forever. And I'm talking about COVID.
Mm-hmm.
How did, and I'm going to follow up question to that, but how did that impact NeighborCare, in specific Columbia City? One of the things that I knew as a media organization was that there was initially a lack of awareness in the Black community that we could even get COVID. It was a disease that old white people got in Kirk. We were ground zero.
Mm-hmm.
And so we had to go on the air and bring somebody on who was from our community.
Yeah.
Who said that they had COVID.
Yeah, it's funny how we only relate when we see someone of our color, our culture, and that's kind of how things go. But yes, we educated our patients that we're all in this together.
Mm-hmm.
We had to maneuver and change things around so fast on a daily basis, from day to day, to make sure that our staff and our patients were safe, that people still got treated. I think NeighborCare did an amazing job at powering through COVID. We're just still kind of like tapering off that, how to treat patients, because COVID is still out there, to treat patients and keep them safe. And I think we did an amazing job at being very transparent with our patients, providers, giving them information, providing vaccines. We ran vaccine clinics from day to day. We had outdoor in the parking lot clinics. NeighborCare did a lot during COVID. I think it was a growing point for us. I think we learned a lot from that if we could survive COVID, we could probably survive anything in this world. It was a lot. Just being a staff and being on the floor working and giving immunizations and talking to patients into like, this is not going to hurt me or harm me. They just heard so many things about it. And then taking pictures of ourselves as staff, showing that we got our shots too, that we're not just injecting people with something, because that was the fear, right?
Mm-hmm.
I don't know what they're injecting me with. Is it real? Do they know where they got it from? So us at Columbia City took pictures of ourselves with our injections and posted them around the clinic for our patients to bring awareness and let them know that it's an okay thing to do. Yeah.
Okay. Now, I mentioned that we might go a little overtime.
Yeah.
Is that okay?
I got a little bit more time.
Because I'm gonna go to break now.
Okay.
You're listening to Street Beat. We're not done yet. We're gonna do a half an hour, but I said a little bit more because healthcare is critically important. If you don't, I had to learn something the hard way. The health work balance is non-existent.
Yeah.
There's no such thing as health.
Yeah. Because you can't work if you ain't got help.
If you don't, yeah. So that's my thing. There is no. That's just my personal thing.
Yeah.
There is no health work balance. There is health.
Right.
So that's just my We're gonna be back, and we're gonna talk more with Juiles Smith, administrator. We'll find out a little bit more about how got through COVID, what was learned about our community, and we're going to, of course, talk more about the healthcare and a little bit more about just healthcare in general and the services that are provided right here in Columbia City. We'll be back right after this.
Ladies and gentlemen.
Speak up, Seattle. We are Rainier Avenue Radio.world, the station that cares.
Don't forget.
This is a Rainier Avenue Radio message on fentanyl awareness in our communities.
So I bring a perspective of a parent who wants to protect the children and the children that live in the community. There's Narcan in elementary school. And I knew that because I was told if you can work in an elementary school, you'll be trained to administer Narcan properly. Elementary school children who may come in with an overdose, and that you as a staff member in an elementary school would need to be able to respond to that. It's my responsibility to be more aware. If they do come to me with questions, but if I go to my school website, I don't know if I would be able to give them a sufficient answer.
This has been a Rainier Avenue Radio message on fentanyl in our communities.
1, 2, get down.
What's up, big and little homies? This is Masvita Maraire, host of Seattle Sports Weekly on Rainier Avenue Radio.world, your one-stop shop for Seattle sports. We cover preps, we cover college, we cover pro, we cover it all. Huskies, Mariners, Seahawks, Garfield, South, Roosevelt, Metro, King County. This is where you want to listen to for all the sports that's happening in Seattle. Seattle Sports Weekly on Rainier Avenue Radio.world.
Welcome to the Fitness Corner. I'm your host, Mark Bryant, and you're going to get a whole total body workout on my show, starting off with a warm-up, aerobics, strength training, cool down, and stretching every Friday from 11:30 to 12 right here on Rainier Avenue Radio.
On behalf of Adifua Cultural Education Workshop, we invite you to join us for the Adifua Day of Action and Media Day on August 15th, 2025 from 3 p.m. to 5 p.m. at the Rainier Arts Center. This event will bring together key community leaders, including Mayor Bruce Harrell's office and King County Council member Guilherme Zahale, to discuss the vital role of culture, community, and legacy in Seattle's future.
You're listening to Rainier Avenue Radio.world. Check us out on social media, Facebook and Instagram, Rainier Avenue Radio.world, and on Twitter at Rainier Ave Radio.
Welcome back. Rainier Avenue Radio World Street Beat. It's me, your host, Tony B. My guest this morning is Juiles Quick Administrator from NeighborCare. It is National Healthcare Week, and this Saturday there'll be a healthcare now, is this specifically at the Columbia City?
Yeah, right across from there. We're blocking a part of the street on Oregon and in our parking lot.
Okay.
And then we're using our clinic for the inpatient services.
Okay.
Yeah.
So, yeah. Oh, that's right. The parking lot is closer to Oregon. Mm-hmm. So if you're saying to yourself, well, I'm not sure where, I think I passed by Rainier Playfield.
Yeah, that's right. That's right. That's right. And we will make sure you don't miss this. We'll have people out there with flags and flyers, flagging people down to have them come and enjoy. Mm-hmm. We want to get as many people as we can out on Saturday to get as much care and resources that they need.
Okay. I do want to follow up, and we were talking about COVID before we left, mm-hmm. but I think I should bring this up and not take it for granted. As you know, in this community, there are multiple languages that are spoken.
Yeah.
How do you, as NeighborCare, effectively deal with for what a lot of folks is an issue or a problem in working with this community, because we have over 60, 70, from what I've heard, different languages and 100 different dialects, yes. which makes it kind of hard for some folks to say, how do we message to this community? For NeighborCare, how do you resolve that issue?
Yeah, I think we pride ourselves in knowing our patients and meeting them where they are and meeting their needs. Mm-hmm. We provide interpreter services for all visits. We have video screens, telephones. We also have in-person patients, so our staff speak those languages of our patients. So we hire staff that speak languages to help better care. So medical assistants, receptionists, different departments, staff can get in and join and help patients when they're speaking their own language, which is really nice. I think it's really awesome.
Now, we broadcast as a radio station in multiple languages. We broadcast in Fijian, we broadcast in Tagalog, we broadcast in Chinese Mandarin, we broadcast in Spanish, we broadcast in America, we broadcast in Vietnamese, because it's who lives in our community.
Right.
And so the point that I'm trying to make here is that you are welcoming.
Yeah.
If English is your second language, if English is not even language that you're comfortable speaking, I'm gonna let you, and we'll have to probably put something on some commercials somewhere where the folks who do listen to this radio station, because of the fact that we broadcast in multiple languages, get this message, because obviously right now we're broadcasting in English. But that's not a barrier.
No.
at NeighborCare?
Never.
Talk about that a little bit.
Yeah, we're breaking down all barriers. So we want to be able to learn our patients, and we invite them to share their cultural beliefs and share with us. That promotes better care. A provider knows like what you believe in, your culture, your history. That in itself supports whole care for patients. So getting to know our patients and their needs, their cultural diversity has always been a driven point for NeighborCare. I think that's kind of what draws me to it the most, that it's not just them or us, it's all of us. And so it makes for I call my melting pot. My staff in particular, from all races, all backgrounds, all ages, including, the one that sticks out the most is Siniki. One of the hardest languages for us to keep or get interpreter services for, which provided barriers. So we ended up hiring on a medical assistant who spoke Siniki, and it's been amazing for our patients that speak that language and getting care. Yeah.
Now, you said something that I think is really important. I did speak specifically about African Americans, Black folks who have a history of not necessarily trusting the medical community.
Yeah.
You mentioned how important it was for you to understand the culture of the different ethnicities that we have here.
Yeah.
Because of the fact that this is healthcare.
Right.
And folks and health is, again, very personal.
Right.
And does that vary with different cultures?
Yes.
Tell me about that.
Absolutely. If I thought about my own culture and African American, working here as a medical assistant beside providers, and being in rooms and working with patients, I think the struggle with identifying or addressing any kind of healthcare. Let's talk about diabetes.
Okay.
One of the main things in our culture. And then managing it and getting patients to follow up and come back with care, being very sensitive to how we address it, especially around nutrition and health and exercise and weight, seem to be really sensitive in our culture for patients, dealing with that and just trying to understand where they came from, how they got to where they are, and then breaking down those barriers so they can get that better care. Yeah, and letting them drive it. We don't want to force ourselves on patients and make them do, I'm the doctor, you're going to do what I want to do. No, a NeighborCare is that we are working with the patient to get to the care goal that they set for themselves.
Yeah. And it's a process.
Oh, yeah.
And that can vary. And that just, again, that is great to hear, that y'all are not only aware, but proactive.
Yeah.
About saying, okay, we have differences in our community. We're not one homogenous community here.
Absolutely not.
And I mean everything aside from culture and ethnicity, the socioeconomic of this community is also one. You have folks who've been here for years and years and years, and then you have folks who are immigrants who are new to this country, as well. And I'm sure for NeighborCare, again, it's everybody's welcome.
Everybody's welcome.
Yeah.
Yep.
So we were talking about COVID a little bit, and I wanted to talk with you about that because it was something that really was impacting our communities. And I remember it was about 3 or 4 months after COVID hit that we got information that we already knew. That those who are poor, those who are from immigrant communities, those who are Black, well, this is impacting them more. But we already knew that.
Right.
For NeighborCare, what were some of the challenges that you faced, and share with us how you overcame some of the challenges because of the uniqueness of the community that you serve?
Yeah, a language barrier and understanding. We have our cultural differences bring up a fear, a lack of understanding. So breaking down those barriers with patients and letting them know that we are here to support and help, not trying to misguide them or give them something that they don't want, giving them all of the information in order for them to make a confident decision for themselves. Not forcing anything on anyone. We didn't force patients to get COVID, but making sure they have the knowledge and information. And it's hard because in our community, like you said, it was almost like they were the last to know. And depending on where you were in this community, you might not have even known that you needed to be tested or you needed to be immunized, and what was going on. So just getting out in the community, partnering with King County Public Health to get vaccines out, to run clinics, to get as many people vaccinated as we could. We did a huge amount of vaccinating within the community and for our patients in this area.
Wow. Once again, this is Street Beat. It's me, Tony B. I told you we were going to get into a healthcare conversation here and talk about some of the things that aren't ordinarily discussed.
Yeah.
There are a lot of things, unfortunately, about health care that are not discussed. And I'm going to get into one of those things now. And I'm going to kind of segue from COVID. When COVID was happening, we had a few days that were hot and we weren't supposed to gather. And folks gathered.
Yeah.
And I remember that there were community members who were, why are folks gathering? We're not supposed to gather.
Yeah.
Well, I'm sure that you're aware, like I'm aware, that for some folks, being at home exposed them to some things that they would often have to leave the house because of.
Yeah.
Whether that was violence or other issues like that. So it's like, I got to get out. I got to, against some of these different things that are unique to different communities. And so I wanted to talk about mental health.
Yeah.
And, when I say mental health, for anyone who's listening right now, and what does that mean to you when I say mental health? Because that's a pretty broad.
Yeah, it could be anything. It could be from domestic violence to trauma in care, trauma at home, stability, psychosis. I think of autism. I think of, there's so many things connected to someone's mental health and state. And with COVID, it pretty much isolated us, right? We were shut up and shut in, unable to get together and do the community things, I call it, that we're used to doing, and that affected a lot of people.
Yeah.
Yeah.
See, I think that we're still coming out of that.
Yeah, we're still trying to get back to it. Yeah. We're still ordering online.
Yeah.
Don't want to go in the grocery store, staying as distant as we can. And I'm hoping that, in the near future, we get back to somewhat what we call I call it our new norm. And people and patients want to get together. So we'll start this off with this event and coming down and enjoying a community event where patients and providers and staff can join and inform patients about healthcare, have festivity and fun and food. It's summer. Yeah. There's lots of festivals coming up this year, and hopefully people are getting out and enjoying life itself, which is important.
So I'm going to stay on this issue of mental health because there are stigmas attached to mental health.
Yeah.
Well, you shouldn't talk about certain things. You shouldn't feel a certain way. You should be strong.
Right. That's cultural, right? Right. It goes back to culture.
How do you encourage someone, or do you encourage someone? What is that process like? For folks who may be watching now, who may be saying, I don't, this is not something I want to talk about. I don't want to feel ashamed. I don't want to feel as though I'm not keeping up with my responsibility, because mental health is a lot of different things. And this is something that you treat, that you discuss. How does that work? Someone who's saying, I don't know if I'm sick. I don't know, you know what I mean? What this is going on with me right now. Is this at NeighborCare? How do you address someone who may be having, again, this wide spectrum of what we call mental health?
Yeah, I feel like we have, particularly in our clinic, we have behavioral health, in Columbia City at our clinic, we do warm handoffs. So if you come in for a visit and it's identified that you're struggling with mental health and need to be seen, we can set you up to meet and greet with one of our providers to talk about mental health or whatever issue you have going on. And it kind of starts with your care team. And then you kind of move on from there, identifying that there may be or may not be an issue, and giving you the opportunity to see someone if you so choose. So presenting the opportunity, I think, is the first step. Not forcing patients into it. Still building that, having that trusting relationship with your provider that they are referring you to someone to help you with something that you need, and then working with them along the way. Yeah.
Yeah, and this kind of leads to something else in that area: substance abuse. Folks who may be addicted, or some of the causes of the things that lead to substance abuse, which of course, as we know, is a mental health concern as well. And obviously there are a number of things here at NeighborCare that we could be talking about. You said diabetes, or maybe some of the other things that you think of normally when you're thinking of healthcare, but these are healthcare issues as well that impact our community. Substance abuse. I think that's a long-standing issue within our community, and we do our best. We have like I said, we reach out to our community resources to provide patients with that information of where they can get help. We have social workers on board to help them with housing, DSHS, paperwork, and all that, signing up for insurance so they can get the care that they need. That's kind of the first step. Like if you don't have insurance, seeing if you're eligible. If you're not eligible, we put you on a sliding scale fee. We work with you to make payments, but never stops you from having care. Just making sure that we open you up to all the resources that are available. Because if you never know, you don't know, right? What you don't know, you don't. So you're just not making sure that patients are given all the resources that are available here, not only in our community, but in the state of Washington. Wow. Yeah. And see, I think it's important to talk about this because you talk about social service that folks may not associate with healthcare. Right. But being unsheltered, being homeless. Yeah. These are things that impact people along with the health. How do I sign up for this? How much? Again, you were just talking about it. All I'm doing is just reiterating what you kind of shared, and I'm going to ask you to kind of share it again so that folks know. Again, when we're talking about NeighborCare, the unique services that you provide to a community, someone may come in with an illness, but there are a lot of things behind the illness that are happening in their lives, which are some of the things that we're talking about today, which are some of the stigmas and some of the reasons why folks may not choose to come in for healthcare, whether it's a substance abuse issue, whether it's the violence issue, whether it's some of the things, again, that folks don't want to talk about because they're happening in their home or in their life. Right. But you provide a number of different services. We do. We do. And if we don't provide it, we do our best to keep our resource binder up to date so that we can give them or direct them in the right path of where they can get the help. So we don't claim to know or have all. We use our community partners and our resources within our communities to support our patients, and I think that's an amazing thing. Like for whole care for a person is that I can direct you here. These are the services we provide, and these are the services they can provide to you. And that's unique. And with NeighborCare is that we try to provide that whole person care. Do as much as we can here while you're here, and then refer you. Yeah. Give you resources. My guest again is Juiles Smith, Clinic Administrator for NeighborCare, Columbia City. Is it Columbia City? Is that what you call it? Columbia City? Columbia City NeighborCare Health. Columbia City NeighborCare. There is a health fair going on. If you've just tuned in and you're tuning in and you caught part of this, there is a health fair that is going on this Saturday. From 1 to 4. 1 to 4. Open to everyone.
Everybody, yep.
Free 99, no charge.
No charge.
And tell us again about some of the things that are going to be going on.
Yeah, food, fun, games, health and wellness screeners, well child checks, immunizations. We can print immunization records for your children if you need them to go back to school. Face painting. Gosh, so many games and fun, and then hoping that we raffle off some great gifts that were donated to this event. So, yeah.
Now, can I give them a heads up and tell them about some?
No, I'm not giving away that.
Okay.
You got to come down and see.
You have to come down. And
but there's some really nice things that the community has given for this event, which is awesome. Yeah.
Wow.
Yeah.
And again, if you happen to just be tuning in and you're going, well, NeighborCare, we did talk about NeighborCare earlier and the history of NeighborCare, and I want to do that again as well. If you can talk NeighborCare, what are you? Why do you exist?
Yeah, we exist because of the community. The patients we serve had a need. We're filling a need for the patients in our community, providing whole patient care, meeting patients where they are, providing them resources, and then doing our best to guide them, to be a guide alongside them with their care. And I think that's an important part, letting patients drive the care and us working with them to get them where they need to be.
Okay.
Yeah.
And we just talked about this. You also, what I'm calling wraparound services.
Yeah.
So if you come in and you're thinking, okay, are they going to understand my circumstances, which impact my health? The answer, for the most part, is yes.
Yes. Yep. You can come in and say, I got a stick on my finger, but I got kicked out of my house last week, and we'll say, we got social worker here, and she can see you after. We can get your appointment, get you in, and see if we can get you some support for that. And I think that's important to be hearing someone say that, even though they came in for that one thing, that a provider can hear that patient say that is a need. They obviously express the need, and that we address it, that we can do our best to help them with that other need, even though it's non-medical, which is important.
It seems that for NeighborCare, one of the things that's important is that you make it clear that you remove the barriers.
All barriers. Yeah.
For healthcare.
Yeah. Yeah.
And we talked about that in again, language.
Financial.
Mental health.
Yeah. Cultural. Everything. We do our best to try to make sure that there's no barriers to care, that everyone receives care. We believe that everyone should have health care. Yeah.
So what I'm going to talk about now, some folks may have an issue with, because we have young folks out here who may or may not feel comfortable sharing information with parents or guardian. Maybe they don't even have good communication with the parents or guardian, but they want health care.
Yep. So a lot of our school-based clinics are familiar with confidential visits. Most of our clinics provide that service for patients that come in that do not want their parent or legal guardian to know, just in case they're receiving a service or receiving birth control or something, but they still have the choice of their care and encouraged to come in and receive care. Yeah.
So I'm talking about that because for some people they go, well, someone's 14, 15 years old.
Yep.
The parent doesn't know.
Right.
How do you make those decisions? How do you decide, well, you know what, this young person wants care?
Right. I think the first step is to make them comfortable enough to come through our doors, getting the message out there that we're here for them, that we provide these services, that we can provide them in privacy, and building that trusting relationship so they continue to come back, and in hopes that they tell someone else that is in the same situation. Because I think with the younger generation is like kind of word of mouth, or I went here and I got this and I was taken care of. They did, XYZ for me, and it was great, and that's, I think over the years we've become the place for young kids to come and receive care,
Mhm.
knowing that it will be confidential and that they'll be taken care of when they come through.
Well, that is good to hear that you're so forthright about this.
Yeah.
How do you go about that process of building that trust in the relationship where you've got young folks out there right now who are trying to figure it out, under certain circumstances, struggling, again, maybe dealing with what they don't even see as mental health issues. They
Yeah.
just see it as life.
Yeah. It's really hard. Like I think the beginning phases of it is that you start to build that trusting relationship with care, coming in for routine care. I mean, it could start at your dentist office, right? And the dentist office will say, or the dental assistant will say, "Oh, hey, when's your last physical? Have you had that?" When we do those things, we have notifications within our EHR that say, "Hey, you're here for dental, but it looks like you're due for a well child check, or you haven't had your flu shot." So technology is great at looping in and reminding us to remind patients of things when we get to lay eyes on them. But then getting the word out and letting them know, going into the schools, and being a presence. And when I say a presence, the school-based clinics are there. No one is forced to go. They're just there to support whenever there is a need.
Jules, I appreciate your honesty in having, and by now, this is how we get down on Street Beat. We have frank, honest, and open conversation.
Yeah.
And we went overtime, and we're still almost out of time. I want to give you the opportunity for final words here. Anything that you would like to share with our audience, whether that be about NeighborCare, healthcare. Obviously, I will again go over the information about the health fair. But whatever you'd like to say right now to our audience.
Yeah, I if I could say anything about NeighborCare, I would say it is a plethora of opportunity. Whether you are trying to grow yourself in health or in your career, NeighborCare has been a long-standing in this community and helped many patients meet their health goals. So we welcome you. As always, NeighborCare invites you to come down or go into one of our clinics and receive care. We're here to support and help in all of our communities across the Seattle area and hope to continue.
All right.
Yeah.
All right. So you're watching this right now. This is, again, critical information. This will be available on demand. So if you've seen, hey, I need this, other people need to know about this. This will be available on demand. You can go to RainierAvenueRadio.world, go to our YouTube page or Facebook page or any of our socials. But YouTube's when people like and watch it again. I just think this is important information. Jules, thank you for what you do.
No, thank you for having me.
And for NeighborCare being here for our community.
Thank you for having me. Appreciate it.
Saturday from 1 to 4, a health fair.
Yeah.
A health fair. And lots of funds, lots of games, raffles. But I think, again, help me out with this, Jules. What you want people to, National Healthcare Week.
Yeah, National Healthcare Week.
This is about being aware
Health
of your
awareness
of your health.
Yep.
And what that looks like and what that means and what that feels like.
Yeah, if you can come down, you can get your blood pressure checked, you can get your blood sugar checked, you can make an appointment to see a provider, get scheduled. There's all kind of opportunities at this event for anyone at any point and on their healthcare journey. So we're hoping that this is a great opportunity for us to connect with you as a community partner and those around.
I like the way you said that your healthcare journey.
Yeah.
Healthcare journey. That's it. That's all the time that I have. That is going to do it for the kid. It's me, Tony B, right here live on Street Beat. Come on down Saturday from 1 to 4 to the Columbia City NeighborCare, 4400 37th Avenue South, between Genesee and Oregon, right on 37th. We'll see you there. And remember this, whether you believe you can or whether you believe you cannot, you're probably right.